to start with. Okay. So, welcome everybody. It's really, really exciting to be starting this series for doctors who are interested in making Aliyah or doctors who are already here. And we're starting this week with adult primary care, but we're hoping to cover all the specialties, different forms of working in Israel. We are ADI, which is Anglo Doctors in Israel with 2 I's. We're a really large community of over 500 doctors who've made Aliyah from English-speaking countries. And our aim is just to bring real experiences, accurate information, and we want to make sure that the Aliyah process and the employment process is as easy as possible, to encourage doctors to make the move and help them at every stage from before Aliyah and decades after. So that's a bit about us. What we're aiming to cover in this talk is, like I said, we're going to keep it really, really specific, just so that we cover everything with the amount of time that we have. So adult primary care in the community, in the public sector, a brief overview of everything, and then we're going to mainly be focusing on the questions that everyone submitted. We're not going to be covering detailed license conversions, any other specialties, any other forms of working in Israel, any other healthcare professionals, and also retirement was a question that got submitted a few times. We're going to do separate webinars covering everything else. So don't worry if we don't answer your questions. And next week, at the same time, on Sunday, we're going to be having a part 2 with some senior Anglo doctors. It's very inspiring because they've made their way up to regional directors and head office doctors. And B, they'll be able to answer more, detailed questions and more technical questions. Anything sort of that we have, we don't manage to cover fully here, we've got next week as well. So be aware of that. Just want to say a huge thank you to the doctors who've joined us. We're taking their precious time. Everyone's very busy, so thank you. We've got Dr. Josh Seshold from Lebrett, Dr. Ben Bradley from Moshe, Dr. Miriam Teitelbaum from Maccabi, Dr. Benjamin Goldstein from Clalit, and Dr. Moshe Weisel, who is an Atzmai working between 2 different Kupot with his own private clinic. So everyone's going to be bringing their different perspectives. So we're going to hand over to our panel just to introduce themselves, and then we're going to go straight to the questions. We're going to be muting the participants because we've put every question that got submitted, and we want to sort of get through them. And then any questions that you have as we go along, if you could just put them into the chat, and we will hopefully have time at the end to answer them. And like I said, if not, we're going to have next week as well. So without further ado, here we go. We'll do it in this order. So if Josh wants to start, and then Ben, Miriam, Benjamin, and Moshe.
Okay, so hello, good evening, everybody. I'm Josh. I grew up in London in the UK. Went to medical school in Manchester, and then did my foundation years, or the first 2 years in the UK, in the north, and then moved down to London for that. I made Aliyah in December 2013 and spent the first year or so in yeshiva, theoretically part-time doing an ulpan as well, but not really. And I decided to take life more seriously. I do an ulpan which stopped very quickly because I got engaged and had to stop working. So I started working when I converted my license in Tehran, which is a like an urgent care clinic. They had them all over the country, like a mini emergency room. After a year or so of doing that, I worked as a cover doctor, so like a general practitioner in Lebrett. After a few months of that, I moved into the residency program, did a residency in family medicine. I had a mini break for a couple of years for health reasons, and I couldn't be physically with patients for various reasons. So during that time, I still continued working with Lebrett, but I worked doing medical approvals on the admin side of things, and I did some telemedicine as well. And then I moved from there to one of what is now my 2 current jobs. So one of my jobs at the moment is I work in a place called Adi also, but only with 1 eye. It's a hospital and school for kids with very severe developmental and physical disabilities. So they have a complex nursing unit. They have a unit for ventilated children. So So I worked there. I worked there full time, and then once my health allowed me to, I came back to the I came back to Lumis and did the residency part time as well, which I finished a while ago. And now I work at both places. I work in the mornings in Adi, and in the afternoons I work in Lumit in a pretty Haredi area in Jerusalem, with a largely Orthodox population. And I do some community medicine in the evening as well, treating gap year students as well through Yeshiva and seminary system. So that's me.
Think.
Thank you so much, Josh. Ben?
Okay. So I grew up in London, went to medical school in Leeds. After other house jobs, so stage in the UK, I then went with a brief detour via emergency room for 6 months to family medicine residency specialization. So a few years after my qualification, I had my family medicine specialty and worked in the UK as a family doctor from 2004 or 5 until 2012. I had my own as a partner in a clinic. For those familiar with the UK, I was a GP principal in a GP practice in London in Stamford Hill. So when we made Aliyah in 2012, I had a number of years experience as a GP, as a family doctor, and I was able to transfer that to Israel without too much difficulty. And since then, since Aliyah, I was in touch with 3 of the 4 Kopot in Beit Shemesh, where we moved to after Aliyah. I was in touch with all 3 of them really before we made Aliyah to put out feelers. And I was in touch with Maccabi, Mechedet, and Lumit. And one of them wasn't looking to take on at the time. 2 of them were, and of those 2, for no very specific reasons other than the general feeling of what was likely to be best for me, I think. I chose Mechedet rather than Maccabi, which was the other choice at the time. And haven't had reason to regret that choice since. I've been working for Mechedet as a full-time family physician since 2012, straight after I finished my Ulpan. So I did work, as Josh did, in evenings in the first few months after Aliyah. While I was doing Ulpan, I worked in Terem in the urgent care clinic in Beit Shemesh, which many Olim doctors do, and is a very convenient way to get into the medical system here. Very easy. It's easy enough to do. You don't need a specialty qualification. You just need a license, and that worked out well. And in Mechedet, I work since I finished Ulpan and I went full time in Mechedet. I work in 3 different clinics currently. I think I've worked in at least 3 different clinics at any one time for Mechedet in the last 13 years or so. All in the Beit Shemesh area, with a brief detour via Yerushalayim and Beit HaRillit very briefly many years ago. All at the request of the Kuppah, what they need, what their requirements for staff are, depending on which clinic. So that's where I find myself now, having worked full time as a GP. I also have got into training residents in the last couple of years, and have the occasional student sitting in with me. So that's that's what I do.
Thank you so much, Miriam.
Unmute her.
Okay, I'm Miriam. I grew up in New York. I did medical school in New York, and I did residency in Pittsburgh. After residency, I stayed in the same medical system for another 3 years, and then which point we made Aliyah. We made Aliyah to Yerushalayim, So I did Ulpan initially. I played with the idea of doing a medical Ulpan, but the timing didn't quite work, and I was anxious to start working already. Um, I had a requirement to do like a 3-month hatama period, an adjustment period, I guess. So um, I, I, I I spoke with the 4 different kupot in the city, and I chose the one that seemed like it had the most reasonable offer. And I got along well with the medical director there. And that Dhamma period was quite informal, and I stayed with that kupa for 2 years, at which point we moved to the north, which is where I am now. And I'm working now with Maccabi as an Atzmai, um, which is more or less the same as not being an Atzmai, except for the pay structure. Um, and I'm working, I mean, it's part-time, but I'm told that for a Maccabi doctor, that's more or less the standard. Something like 23 hours, I think I'm working, which works out very nicely for me. It's a good work-life balance. I also have medical students about half the year, which is nice because I don't have a lot of built-in CME that's easily accessible to me. And I think that covers it.
Brilliant. Thank you, Miriam. We're going to just, for everyone, we are going to be covering all these different terminologies and going into detail, so don't panic. Who are we? Benjamin. We can't hear you. We'll go Moshe and then we'll go back to Benjamin.
So I grew up in Miami, Florida. I trained in Chicago. And after finishing family practice training, I moved to Silver Spring. I worked at Silver Spring, Maryland for 2 years. We made Aliyah in 1999. When I came on my pilot trip, I just was able to find that there would be jobs available, even though I wasn't able to find a specific job, but I was comfortable enough knowing there would be jobs available. We moved here in August of 99 with 5 kids. So I did a little bit of Ulpan, but was anxious to get to work somewhere because I need to support the family. I live in Gush Etzion, and the practice that I found was a practice of the Efrat Medical Center. And they are a practice that we're working with 3 different kupot. They're working with Maccabi, Mochet, and Leumit. So they hired me into their practice, and one by one got me into the different kupot. Different stories for each kupa. I was initially sent out to Mali Amos and Meitzad, which is Eastern Gush in the middle of nowhere, to work with Leumit. I did a little work in Beitar and Leumit. I was in Mochet in Beitar. But all the time, my relationship to the Kupa was an Asami relationship, and my relationship to and I was an employee of this group practice where 4 different Asami were working together in a group practice and then getting money from the practice. With time, the senior people in the practice have moved on and retired or moved elsewhere. So it's now my practice. I'm in a frat about 30 hours a week and have someone else working with me. And then I have a small practice at home, sitting in my home clinic right now, where I have 1.5 to 2 hours a day, seeing people there from Maccabi and from Muchelet.
Brilliant. Thank you. Benjamin?
Can you hear me now?
Yes, we can hear you.
Okay, this is just a tiny button. So I'm Benji Goldstein. I'm born in Montreal, Canada, and I actually made Aliyah ages ago when I was very young. And after my military service, I moved back to Canada, where I spent 17 years as an adult, completing my degrees, medical school, and residency at McGill in Montreal. And promptly after residency in family medicine, I moved to rural Canada, a small town called Suluka, where I was briefly co-chief of the practice. And then I moved on to be the chief of inpatient medicine, which there is a family medicine position, not an internal medicine position. And then after 5 years in Suluco, my wife and I and our children finally achieved our goal that we'd been planning for a long time to it was sort of make aliyah. At Toshav Chozer, I'm a returning citizen, but my family was making aliyah. The pay structure here wasn't so appealing to me at first. So I actually spent my first 4 years in Israel traveling to Canada once a month, where I would work 4 days a month plus some travel days. And that was paying, I think we're going to talk a bit about pay comparisons later, but that was paying pretty equivalent to what they were paying me, offering me here for a full month. And eventually I worked towards my goal, which I'd always had, of finally getting my GP license here and ultimately my family medicine license here. And so that took me about 4 years till I finally got on it. And I did my Kufat Hatama, my observation period with Kupat Cholim Klalit, where I had a very good fit and they very aggressively wanted to keep me. They are a very large kupa, which means they have a lot of resources all over the place, and they happen to have a clinic in my neighborhood. And I opted for the studies that show that work-life balance is best if you live within a 15-minute commute of your workplace. So I live 4.5 minutes from the clinic that I chose to work at, which was in my neighborhood, which has been a really, really, really wonderful experience. And that's part of the reason I chose my kupa. Another part of the reason was they offered a really great salaried employee option, which included sick days, vacation days, pension, and things that were foreign terms to me as a doctor trained in Canada, where independent was the only route to go. So they found me more than I found them. I've been very happy with them. I could be happier, I suppose. And Klalit, a little bit my kupa, is very large kupa. They cover about 53% of all patients in Israel are signed up with Kupat Cholim Klalit. And they provide service in all across the country, but particularly they're one of the only kupot in the very, very rural niches that are able to, that have wide enough resources to get into those locations, which I also enjoy, because in addition to being a salaried employee at my local clinic in Jerusalem, I also travel down a few times a week to Engedi, where I'm an independent contractor with Klalit. And I also work as the Engedi doctor there, split with another doctor who's the primary doctor. He contracts some of his work out to me when he wants to be off a little bit.
Okay. Thank you so much. And I just want to introduce as well 2 bonus doctors that we have. Dr. Eli Krantman, who is here, who's a manager of a clinic in Klalit, and the reason that I found my job. So thank you for being here. And also one of the teachers in our residency program here in the Central District of Israel with Klalit. So he'll also be helping to answer some of the questions. And Dr. Martina Hammelburger, who I think I saw here as well. Hammelburger, hello. Thank you so much as well for joining, who is a Maccabi doctor in Yerushalayim. So we're going to start straight away with the questions. Over to Josh.
Okay, so the first question is, how does the Israeli healthcare system work? Israel has a universal healthcare system. So it's free, or largely free at the point of care, and it's paid for by taxation. So the way it works practically from a patient point of view is there are 4 HMOs. There are 4. So if you're from the UK, instead of being one large NHS, there's 4 mini NHSs or 4 HMOs. They're called Leumit, Klalit, Muchedet, Maccabi. Klalit, like Benji said, is the largest, about 50%. And Maccabi is about 25%, and Leumit and Muchedet are the smaller of the 4. They all, by law, have to provide the same basic basket of services. So it doesn't matter. Theoretically, on paper, it doesn't matter which of these kupot you are in. You're entitled to the same services. What that means is that at least on those services, the way those kupot functions, they're trying to get more patients, and they compete on the availability of their services. That's at least how theoretically it works. So on the basic basket of services, you can get the same thing everywhere. There's also top-up insurances. So 95% of what patients need and use every day is on the basic basket of services. But things like dental care are not included. Certain medications might be included for more indications if they pay for the additional top-up. And all of the kupots have that top-up insurance as well. and they're all pretty equivalent. As soon as one increases one benefit, then everyone else tends to copy because they're competing with each other.
So I was going to quickly talk about the residency program in Israel. I'm a resident in my third year here. So it's a 4-year program. As you can see here, I've just listed what it's broken into. Essentially, the first year, you're in a clinic, or 15 months, being supervised, seeing your own patients. Then about the middle 2 years, you're doing rotations in the hospitals, which has been great and quite an experience if you are coming, making Aliyah and you haven't had the opportunity to be in the hospitals here. And then the final year is back in the GP clinics with your own patients, less supervision, before you finally graduate. And there are 2 exams that you have to pass: a Shlav Aleph exam, which is a multiple choice question, and a Shlav Bet exam, which is more of a panel case-based exam. And then you have to also complete a diploma. During you get a day of teaching a week, and you're doing 6 semesters throughout the residency. One of the questions that came up was about subspecialization. So as far as I'm aware, and I looked on the website, but please add if anyone else knows otherwise, these are the subspecialties that once you have a family doctor license, you can then go on and do an extra, generally it's 2 years to 2.5 years of training to then become a subspecialist in the following, so palliative medicine, infectious disease, etc., etc. So that's interesting to know about. And then just briefly about converting your specialty license. So if you're already a family doctor and you want to move here, so recently they're working very hard to encourage doctors to make Aliyah, especially the English-speaking ones with excellent training. So they created something called the green pathway. Forgotten the wording, but essentially it's to speed it up. The people who are eligible are anyone coming from these countries, so mainly the English-speaking countries and France. And essentially they're comparing the residency program that you did in that country to the equivalent program in Israel. And it has to be fairly similar, so having covered similar amount of time and similar rotations and similar procedures if it's a procedure-based specialty. They have a council that will basically sit down on a case-by-case basis, will decide if you sort of meet the criteria. If not, they might suggest that you have to make up some time in Israel with an extra 6 months in a certain department or things like that. And it's very individual and unique. So some people aren't always, it's not always clear to them why they didn't pass that they weren't eligible and they had to make stuff up, make time up. So just to be aware of that, and obviously you have to be a specialist and have worked consistently. And these I've just put here the 2 email addresses which are important to know, and they're the people to contact if you're having problems with this. And it's all done on an online portal as well.
Rivka, this is a very interesting thing, just because this is new, as you said, and it wasn't around when I did it. And for years, I was actually a general practitioner as opposed to a family practitioner, because I didn't convert my residency. I didn't do the extra 6 months of supervised care. There was a slight difference in pay, but eventually the acupuncturist says, okay, you've been here long enough, you could be a family practitioner now and never did anything else. But now it's green path and you can do it right away.
And Rivka, if I can just jump in, as someone who was daunted by the paperwork I had to submit, to the point that I was traveling back and forth to Canada every month because I just couldn't face the paperwork. When I finally sat down and did it, I was amazed at A, how supportive and helpful they were, and B, how much easier the process was than I thought it was going to be, and how quickly they responded to all my credentials and gave me my Israeli license. I was really surprised how smooth it was.
Amazing. So who was answering this?
I think that was that. Is this slide 9?
Yes.
Okay. So I guess this was me. So I guess I jumped in at the right time. So
Perfect.
the timeline I'll share. So there's two ways to go about doing it. If you're disorganized, you do it like me and you wait till you get to Israel, travel back and forth for a really long time, which is an option, and slowly work on your paperwork. I have a cousin who converted his radiology license and he submitted all of his paperwork ahead of time. It's really just a long list of checkboxes. There's a portion you have to both convert your medical license, which then gives you a GP license, which lets you just work as a general practitioner. And I'm not going to get into it. I think it comes in the question later. And then after you've gotten your GP license, sorry, not after you've gotten your GP license, you can actually submit all of your specialty documentation at the same time and have those documents start to be processed while you're getting your GP license. If you're disorganized like me, I had my GP license first and then I finally submitted my documentation. Like I said, you can actually do all of it except for submit your ID number, your Teudat Zehut, before you make Aliyah. The last piece that you need is the ID number. And the only part that, assuming you've worked enough time and have enough experience in whatever country you're from, the only part that you have to fill in once you get to Israel is the Hebrew language requirement. I think there's a test you have to do. I'm not familiar with it because I was exempt because I did high school here, but I'm told that it's a pretty decent process. First paycheck, when I started getting paid while I was doing my observation period. So before I was even a family medicine practitioner in Israel, I was working under observation with Kupat Cholim Klalit to get the experience I needed to be able to transition. That was a 3-year observation period in my case. It can be longer or shorter depending on various criteria. And that was a paid observership. It's generally 3 months. I've heard of rare cases of it being shorter and of other cases, again, it depends where you're coming from. But yeah, generally it's 3 months. And depending where you're doing it, Klalit would not take the Ministry of Aliyah's money, but it's actually a finance thing. The Ministry of Aliyah pays a stipend. So if you're doing it somewhere that isn't Klalit, because Klalit has deeper pockets because they're larger, then either way it's funded and it's a paid observership.
If I can just jump in there, just along the very same lines, 14 years ago, I was able to submit all the paperwork for the specialty license before Aliyah. You have to do all the paperwork had to speak to my medical school, had to get you to really go through it, make sure you have every single document they want, put it all together, make sure it's all with you. You can basically get your specialty license, except for a period of supervision, before you make Aliyah. And it's just the actual license itself then took me 6 weeks after that, because I had all the paperwork, 6 weeks after Aliyah, I had my license. And then I just had a period of supervision, and then I had my medical license. Within about 9 months of landing, I had both license and specialty, and that's quite possible so long as you have all the paperwork.
Okay, brilliant. Miriam. Oh, no.
The slide order changed.
Have I deleted the slide by accident? So this was Benjamin as well.
Yeah, sorry. Did we want to do the deleted question? I'll just go. So I heard that a lot of the doctors here were talking about having worked as GPs before they got their family medicine license. Like I said, I was disorganized about the process. I got my GP license. I didn't get my paperwork in. I tried to find work as a general practitioner just because it was the war and it was getting hard to travel back and forth, and I just wanted the income. And I had a really, really, really hard time. I actually contacted a doctor from Terem, an organization that some doctors here have mentioned. It's sort of like a private urgent care center.
I'm really sorry to barge in, but there's been some confusion. When you say general practice, the UK doctors think that you're referring to a family physician, sure, which is a specialty. You are talking about a Rofé Klali, which is not, yes. So can you just clarify that?
I will clarify. I apologize.
Thank you.
I apologize. So I'm Canadian. In Canada, the term general practitioner used to exist, and it doesn't exist anymore. We used to have general practitioners, which is a European term. So a general practitioner in Israel would be a Rofé Klali. It would be someone who completes medical school, does a 1-year rotating internship, and then they don't have a specialty, and they're limited with how much seniority they can gain. They're also limited with their job options available to them, as I was just talking about mine. And then a family practitioner or family doctor is a specialty, like every other specialty. It's a specialist in family care, and this is someone who's completed training as a family doctor. So general practitioner would be an unspecialized doctor, רופא כללי in Hebrew, and a family doctor would be a family practitioner in the community. So as I was saying, I initially had my GP license, and I was in touch with a doctor from Terem, an organization that several doctors have mentioned here, a doctor who knew me, who knew my background, who knew my rural medicine experience, who knew I had emergency room experience as well, who told me that they would love to have me on board, and then their HR department said they're not hiring. And it was a bit of a frustrating experience, and the salaries were significantly lower, the conditions were significantly lower. And that's essentially how I ended up doing my hatama, my observation period. It was easier for me to actually get into an observation period and do an observership and then get a job as a family doctor than it was to work as a non-specialized doctor. So you can work as a general practitioner, as a רופא כללי. I found it to be very not worthwhile. The conditions weren't great, and it was, like I said, I got paid just as much to do the conversion as I would have gotten paid if I chose to just keep my license as a רופא כללי and not do the observership.
I'd just like to jump in. I mean, I've been here 27 years, and I became a family practice doctor recognized in Israel about 3 or 4 years ago. I mean, it's 24 years I was practicing as a רופא כללי. I definitely recommend doing your residency, getting recognized as a specialist. Each one of how I joined the Kupats, each one has a back door how I got in because they needed somebody at that time at that place. Otherwise, they wouldn't have hired me. The Kupat definitely want to see your specialty before they'll hire you.
Yeah.
If it wasn't clear, I 100% agree with that.
So this question we're going to be answering next week. Yeah, it'll be Kupa dependent and department dependent, but generally the answer is no. But we'll ask the technical question next week to the senior doctors. How do you find your first job? To Ben.
Okay. I don't know how other people found their first jobs. I just know how I did. But I think it's probably similar-ish for most people. And really, the answer was actually contacts. Before Aliyah, I picked the brains of anyone I knew who was either working here or knew someone who was working here or had a third cousin once removed who was working here. And just tried to get the information I could to make contact with people who might be helpful in finding a job. As it was, I managed to make contact via indirect personal contacts with people who were running the Kupot of Mechedet, Maccabi, and Leumit in Beit Shemesh, because I knew that's where we were going to be moving to. And by direct contact with them, I got the job in Mechedet. The truth is, it wasn't that difficult or competitive, because there was, I think it's the same now, but there was a real demand for specialty GPs, family physicians who had specialty training. And two of the Kabot were quite happy to take me on as I was. So I didn't find it difficult, but I think that might have been just in Beit Shemesh. I don't know exactly, but that was my experience. That if you do try and make contact with people in the area around where you're going to be living, with the Kabot there, you can usually be able to find a way to speak to the person in charge locally. And make direct contact and ask that way. Even without personal contacts, they're generally looking for doctors, and will be happy to speak to someone who approaches them.
If you have something to add to this, as my contact, generally, like Ben said, it is all about contacts, which is one of the things that we're trying to achieve with the ADI network, so that you'll always have someone in whichever hospital area, Kupa, that you're looking for. But getting someone on the inside is definitely the way to start.
I do believe the Kupot are actually recruiting now. I know, like Mochedet put out a big ad in the Jerusalem Post a couple months ago, looking for the Anglo doctors. So definitely more of a recruitment. Question is, do you know where you want to live and only want to work there, or are you willing to sort of find out where the jobs are available and move where the jobs are available? If you're willing to work in the periphery, that's definitely more, availability maybe.
Anything? Okay. What is the difference between an Atzmai doctor and a Sechil doctor? So we've been throwing these
Okay.
phrases around. Josh.
So an ASME doctor and so there's an echo. Okay. So an ASME doctor and which is an independent doctor and a salaried doctor. So you can work in all of the kupot in either way. Generally speaking, a salaried doctor has a regular monthly amount they're going to be getting as a salary. Your employer, so the health organization, the Kupa, will pay pension. It will take off the taxes, and you'll go and get you'll get a payment into your account, which has got everything taken care of before tax-wise before you get it. The advantage of that is that you have a regular income every month. That you have your benefits, not just pension, but you'll also, as being an employee, as being an employed doctor, you'll have holiday, you'll have sick pay, you have various other benefits. Sometimes you get discounts in the kupra that you're working in. So it's very good for stability. The other way of working is being atzma'i, which is basically like being an independent contractor. So you still work in the same kupot, you probably work in the same clinic, but rather than getting a salary per month, you get paid depending on the specialty and depending on your arrangement, either per hour or per patient, or sometimes per session. Some people will take in like atzma'i payments for home care, or and there's different ways of arranging that. Generally speaking, the payment per hour is higher as an atzma'i doctor, but you don't get the holiday, you don't get sick days, you don't get employee discounts, those kind of things. So, and you don't have to necessarily choose between the two. When I was doing my residency, I was a regular employee at Longmeat, but my wage went down when I did that. So I also worked at the same time as an atzma'i in Klalit. And now that I finished the residency, I worked a few months as a regular salaried doctor, and now I work atzma'i in Longmeat. So currently, I have half of my work as a salaried doctor and half of it atzma'i, and that for me at least gives a good balance because I have my regular thing and I have a slightly higher income on the other work as well.
Thank you. We've got the next two slides are going to just go more into depths about Atzmai. Before we do that, does anyone want to add anything else? And we'll just keep going. So,
Rivka, I'm sorry that I'm interrupting. My computer was stuck before. I heard that there was a question for me, and I couldn't hear what the full question was.
It was this question: how do you find your first job? I was wondering, as someone who's within the department, if you have any advice. But we.
Well, I'll let somebody talk about that. And if there's a question regarding getting into a residency, I'd be more than happy to talk about that.
Okay, so we'll carry on, and then if it comes up later. Thank you. So what's involved in getting set up as an Atzmai doctor? Practicalities and how to actually succeed in bringing the patients in. And what are the pros and cons of setting up your own clinic versus working in a Kupa branch, and then working with one Kupa versus a few Kupot. So Moshe has a lot of experience with that.
Okay, so first of all, within the Atzmai, within the independent contractor, there is being an Atzmai in a Kupa, where you could go work in a Maccabi Snif or Mocheda Snif. You get paid per patient. They take a clean 10%, 20% overhead fee. And you're given your room, you're given your computer, you're given the nurses are there, the equipment is there. So that's what you're paying your overhead for. But you sort of determine your own hours. They still sort of you can contract them to the hours that are there. And that's Atzmai in a Kupa building. I am Atzmai in a private clinic, meaning we rent space in a freestanding building. One and the other, I have a private clinic in my house where I'm using a room in my house. Therefore, all the overhead is on me. I have to pay the rent. I have to hire the secretaries. I have to purchase whatever equipment there is. My main practice is in a building that has a Maccabi and Mucheret in the same building. So when I send people to the nurse, I just send them down the hall. When I worked with Leumit in the same building, we actually hired a nurse that we were paying with help from Leumit. So you have to take that all into account, that you have to pay for all this overhead. The advantages, so the advantage or disadvantage is that you make your own hours. There's no one telling you when you have to work or when you can't work. At the same time, the responsibility, for about 20 years, there was always somebody making sure. We would never close the office. If someone was taking vacation, they had to make sure someone else was covering them. And it's not always the easiest thing to do. If you're working as a sachir, you say, okay, I'm taking a week. Kupa, find me somebody to work for me. If you're atzmai, someone, you have to find someone to fill your shoes or close your office. I have learned recently, after some coaching, that you actually can close your office a half a day a week, or every couple of weeks you take a day off, and no one's going to panic that other things are going to happen. But that's an advantage. You're flexible, but a disadvantage is that you always have to provide the coverage. And then from a money standpoint, also, when you compare the atzmai salary, which is you can make more per hour, you have to take off your overhead, which could be like 20-25%. You have to then put your own money into pension and Keren Hishtamlut and Pitsuim and all these different things, so I think we're going to discuss the numbers later, but there are more things that you have to spend money on. The advantage of working with more than one kupa is that you have a bigger patient pool to pull from. The kupot, again, they don't necessarily want you. They want you to work for them themselves. But I'm able to see both kupot at the same time because I'm not working in a snif. So, I can have a Maccabi patient, Mucheret patient back and forth the whole time, and it gives me a larger pool to pull from.
Brilliant. Anyone else want to add anything or any questions whilst we're on the topic?
To add something to what he said. I'm not sure how it works in Mucheret and Leumit, but in Klalit, I'm not an atzmai, but I do work with atzmai. I mean, I have doctors that work in my clinic as atzmai.
Taking a nap.
Not taking a nap.
Can you make your schedule?
Sorry. So regarding taking vacation and things like that, there is, in Klalit at least, the doctors are expected to give X amount of hours a week, to the point that if they do not give those hours, the expected hours that week, their salary will be deducted from. So there are issues there as far as when you can take off and things like that.
Can I just jump in? I'll point out those hours are transferable, so you can make up those minimal hours like the following month or the same month if you didn't work those minimum number of hours a week. And I'll just say, as someone who's sort of, as an independent practitioner in Canada, the word retirement was so daunting, and it was such a pleasure for me to join something I'd never heard of, being a salaried doctor as a doctor, which doesn't exist in Canada for the most part. And to suddenly hear these words that I never heard before, like sick days, vacation days. And I think the big one was a pension. And when I looked at salary versus independent models with Klalit specifically, the salary gap, I mean, it looks like you're making more money as an atzmai, but when I looked into percentage-wise, how much the kupa was adding onto my salary, what their contribution was towards my pension, and what that added up to in 20, 30, 40 years, and I discussed it with, financial advisors and family and friends and people who are in finances, there was no comparison. It wasn't a question. I knew I was going salaried.
We have a slide later about salaries, but we can have that discussion now about the pros and cons.
So first of all, I think a couple of years ago, Israel passed a law that everybody has to put money into pensions. You can't even be an atzmai or independent without they want you to put money into pensions. And I will say that, yes, when I was here 27 years ago with a big family and no money, I was not, and I should have been putting money into pension, but I wasn't. But now definitely I'm putting a large percentage as maximum tax, deductible amounts into pension and more. So I'm making sure that goes in. Just to speak to the actual number, when you're talking about Keren Hishtamlut, Keren Pension, and Pitsuim, so just so people know those numbers, as an employee, 2.5% of your salary goes into Karen Hishtamlut, and the employer adds 7.5%. Karen pension, I believe it's 5 and 5 from the employer.
Sorry, Moshe, can you just translate those phrases? Because some people are just new to the whole concept.
I understood them better, I would.
Or someone else.
Karen Hishtalmut is a tax-free savings scheme. So if you're employed by the Kupa, 2.5% of your salary will be tax-free savings. So any interest that's accrued is tax-free, and the employer adds 7.5%. Whereas if you're Atzma'i, then you have to make all those contributions yourself. You don't get the benefit of your employer paying into it. And that's the same with pension. So pension the employer would give for you, and as an Atzma'i, you have to go make your own pension payment.
Pension, I believe, is 5 and 5, and then there's pitsuim, which is unemployment. So if you were ever fired or left your job, so that's another 8% that's put away. So basically, it covers a month's salary a year. That's also implied. So when you take a sachir salary, you're actually the employer is paying another 20.3% on top of that. You'd have to add into that.
Anyone else? We'll move on.
I think I have one more last point just to say as an Atzma'i. For the Americans out there, if you are a true Atzma'i, working independent, you are responsible to pay American Social Security payments of 15%. That will come off the top of your salary. What most people do, and what you need to do if you're going to do that, is you need to open an Israeli corporation. So you are, in the end, getting a pay stub from somebody, and that frees you up to 15% from the Social Security. If you don't do that, you're going to pay another 15% just to Social Security in America. So that's a technical point from an independent contractor. You need to get yourself a pay slip somehow.
Although I think that they just put something through Knesset that there's a 10-year agreement that you don't have to pay double Social Security for Americans. Is that right? Is that anyone else saw that?
I saw something, but Americans want your money whenever they can get it.
I don't know if anyone here is Canadian. Canada has a tax agreement with Israel, and you do not pay double taxes. As a matter of fact, I work in Canada. I work simultaneously in Canada and Israel, and I pay taxes there on what I make there, and the Israeli government doesn't touch it, and vice versa. It's actually quite nice.
Okay. This again we're going to discuss next week with those who are involved in the employment process. Just about how your geographic location is going to affect your job opportunities. Miriam. You're muted. Are there differences between working in central Israel versus the peripheries?
Okay. So in terms of the differences between working in the center versus working in the periphery, when I moved from Yerushalayim to the north, I found that there was a lot of I was missing a lot of the diversity that I had in Yerushalayim, patients from all over the world, and I really missed that. There's also a lot more where, and here's the thing though, it has to do a lot with the specific branch of the Kupa I was in. I was in a very big branch of the Kupa. There were a lot of specialists. It was a very central location. And then I moved to the periphery, and relatively, I'm still in a relatively large branch, but it's smaller with many fewer doctors. We work a split day, so the office is open 4 hours in the morning and 2 hours in the evening, which is not an uncommon scenario. There is much, at least again where I am, there's much less patient diversity. There's, instead of 20 languages I can choose from in Google Translate, I really only need 4. And then another point I will make, which is unfortunate, I've heard from other doctors, and I found it to be true, that people say medicine stops in Haifa. Above Haifa, the medical care is unfortunately spotty, difficult to access sometimes. I'm not saying that to discourage people from coming to the north. dafka the opposite. We really need doctors, good doctors who have availability, but that's the reality. On the plus side, I work in a kupa that's walking distance from my house. I work in my neighborhood. I see the people that I treat for good or for bad in the supermarket, treating community members, which is also very rewarding, which I didn't have in Yerushalayim because it's just such a much bigger place that you don't overlap so much.
Thank you. I think also financially, I don't know if Dr. Krantman, if you can add about the way the salary is based, if you're receiving more per patient further up north, at least in Klali, in the peripheries.
I don't think it's more per patient, but there are benefits that are given. The Klalit salary is something that takes a whole residency in and of itself to understand. But I don't think it's more per patient. I believe that there is some sort of extra payment that's besides that.
I'd like to add that periphery is a relative term. I don't know if Gush Etzion is considered periphery or not, because we're really only 15 minutes from Yerushalayim, but there's definitely a difference in, like, we don't have a lot of specialists around. And for the good and the bad, if you want to be family practice and want to do a lot of your patient care, there's a lot more responsibility you can do. So you don't have the same number of, people might not want to travel the 20 minutes, half hour to Yerushalayim that they can, but I feel like there is some more responsibility. And I don't think we have any internists by us, because you need to if you're even in the periphery of Gush Etzion, you need to be family practice to be able to see the kids also, even though we have pediatricians, but they do not really want internists outside the big cities.
And that kind of answers some of the questions that were asked on the chat regarding the difference between internists and family medicine. In Israel, anybody can write on their door that they're a family doctor, but not everybody can write that they're a specialist in family medicine, and that's the nuance. And that those that have finished a residency in family medicine are allowed to be seeing kids from birth till 120. And whereas, as far as I understand, internists cannot, or at least should not, be doing that. Also, there's another nuance, and that is that those that do a residency in family medicine sometimes kind of have a different perspective on the patient and the whole approach to the patient as within the family perspective of things, and that's just another kind of added value to the residency, as opposed to somebody that comes with a broad spectrum of knowledge and is excellent in diagnosing and taking care of patients, but doesn't necessarily see things the way one who has done a family residency sees things.
Okay, thank you. So this was about the structure of day-to-day, how it looks.
I can't hear you, Rivka.
I'm muted. Can you hear me?
I can hear you.
You can hear me. Take it away, Ben. The question is, what does the day actually look like structurally? The next question is about what sort of medicine we're seeing.
Okay. I think the schedule is going to vary. I don't think everyone works the same way, the same hours, the same timings. My day is relatively typical, but I work 40 hours a week. Well, actually 37 hours a week, minus 3 which I do for home visits. That's a separate part of what I do, which is not every Kupar has a do you see patients at home as well, do home visits, but I do that as part of my Mechedet work. And in Mechedet you can do that, but I don't know how standardized that is. So I spend 37 hours a week in clinics, 8 till 12 every morning, and I do a split day, which is where I'm slightly different perhaps to what many other people do. And I think more people more often work a straight day, 8 till 4 and 9 till 5 or something like that. But I do mornings. I have a 3 or 4 hour break, and then I work another 3 or 4 hours and finish at 7. I do have one morning off, and in those 3 or 4 hour clinics, I see patients every I see patients every 10 minutes or 12 minutes, actually depending on the individual clinic. I work in 3 different clinics currently, and 2 of them are 10-minute appointments, 1 of them is 12 minutes. And that's somewhat negotiable, I suspect, once when you start working for a given clinic or a given coupa. And I will see a full range. I do see children. It's come up in some of the questions that come up whether you see children or not. As a UK trained family physician, and also if you're Israeli trained, you can and have experience and you will see children. And I see all ages. And I will see the full range of what you expect a primary care doctor to see. Some differences if we're coming from the UK. I don't know exactly how family medicine works in America or elsewhere, but UK family medicine, you are the only primary care doctor around. There are no pediatricians, there are no gynecologists in primary care. Everything comes to you first, psychiatry, everything. So it's slightly different here in as much as you do have specialists working in primary care clinics, either on your doorstep if you're in a bigger city, certainly in Yerushalayim, and also in Beit Shemesh. It's easier to get, people can take themselves directly to some specialties and fairly easily to other specialties, much more easily than you can get yourself to secondary care in the UK to see a specialist. So I don't, for example, I do very little gynecology or obstetrics work, pregnancy care, which in the UK was doing more, but here people go to see gynecologists for most of that, apart from maybe contraception comes up frequently, some other things, but very little does. More children than not tend to go to pediatricians, although I do also see a lot of clinic children because I'm not always working in direct proximity to a pediatrician, so I do see quite a lot of children of all ages. And that, so I get the case mix which you would expect with that kind of setup. Anything else which I should be talking about in this context?
No, that's good. I wondered if you wanted to compare that with the independent doctor, Moshe, as an atzmai, if your schedule is the same or.
So again, I think I have more control. I think I have more control of my schedule, although it's the same. I work 5 days a week at my frat practice. I either go from 8 to 2 or from 12 to 6, depending on the day of the week. And then I have the other hour to 2 hours at home. Those 6 hours never really be 6 hours. They always turn out to be more. We have this whole system of online messages and online calls and everything, so you always overflow on paperwork. But it being that it isn't an atzmai practice, I can close from time to time. Again, the doctor who works with me works 5 hours a day. So we have the office is open from 8 in the morning till 6 in the afternoon every day, except for Friday. So there's good coverage. But if someone takes off, so we'll work a half a day, and not cover the other half a day. The patient range is as we see children as well as adults. As Ben was saying, there is no real gynae work for me here. There's no deliveries. If you're trained in Fem America and obstetrics, there's no, that doesn't even happen here at all. Yes, contraception does come up. Women's health does come up. That's definitely a needed field. For anyone who's interested in women's health, that's a strong need. And there's a question on the bottom where it says burnout. And yeah, if you allow yourself to keep doing this over and over and over again, you can burn out with it, which is why it is important to take breaks and do other things and try to get other interests. A couple of years ago, Maccabi offered that to a course in dry needling. There's courses in bedside ultrasound that people, POCUS that people take. So a lot of different other things you can add to make your day a little more interesting and keep the variety there.
Thank you. Eddie?
Can I just add in something here?
Yeah.
I think it's important for people to remember that, the IMA, the Histadrut, there's an official scheme. I don't even know how to say that in English. That it's like a contract, basically, that dictates really how many patients per hour doctors should be seeing and how that should look as far as how many of those are scheduled by the office and how many of those are scheduled on at least by the doctor's discretion. And everybody should know, no matter which kupa you're in, that there should be some sort of like a union that protects those rights. For example, in my clinic, I'm very, very careful with those kinds of things. And in general, Clalit kind of spearheads those kinds of things. All the Heskemim, all the contracts that were signed with IMA regarding primary care were led by Clalit. And basically what goes by us should go by other people. So, if anybody ever has an issue with that, whichever kupa they're working in, they should know that they should contact their union doctors and look up that contract, see what it says, and be able to fight for their rights. It's a very, very there's a lot of tension with that issue. I'm sure Rivka knows exactly what I'm talking about. Like how many patients you see an hour and who decides and who dictates that. But there are rights there, and in fact, it's probably going to be rewritten soon.
Thank you.
About rights and working conditions. Working conditions in Israel, I think, are generally, certainly as a salaried doctor, that's all my experience, are pretty flexible, depending on how much your kupa needs you and how much you're able to negotiate with them. There is as an investigative Israeli society, rules aren't always rules, and conditions aren't always conditions. And if something doesn't work for you, you can usually, if you speak to one who steps up in the hierarchy, manage to work something out. If something is too busy, not enough time, other aspects of working conditions. Just for example, I take 20 minutes in the middle of each of my 3 or 4 hour slots. I take 20 to 25 minutes break in the middle, which is not a break. That's the paperwork time, because otherwise all the time is used up with actual appointment time. And I just negotiated that years ago. I probably should increase it slightly because I've got busier than I was. But that is exactly the sort of thing which the number of blank slots you need for paperwork, the exact hours, is usually something which can be negotiated if you've got a decent line management.
Okay, thank you. We're going to speed up a little bit just because I want to make sure we have time for questions and answers at the end. We discussed briefly about the differences. Anyone wanted to add? I'll just list the primary care specialists that you can access directly are ENT, orthopedics, OBGYN, and I'm missing one.
Dermatology.
Thank you very much. So generally, people can book directly without a referral.
Ophthalmologist also.
Oh yeah, ophthalmologist 5. Josh, Miriam, did you have anything you wanted to add to this?
I just wanted to add one other thing. So in LawMeet, the default by most doctors is they see patients every 12 minutes. It's acceptable to check every 15. I only allow patients every 15 minutes because I don't take breaks to do other paperwork and results and whatever else that come in through. Something that is very, very beneficial. I have experienced this in LawMeet, but I'm sure it's the same in all of the Kupots, is that at least since COVID, they have been very, very, very good with their online support with specialists. So not only do you see specialists in your clinic, but we've got doctor-to-doctor consultations, which are very quickly answered. So rather than me referring someone on to see a neurologist or referring on to whatever else, I can write a message to them. Normally within a few hours, I have an answer back, and it's much easier for me, much easier for the patient. There's a lot of support, definitely compared to how I saw things in the UK, where really primary care was GP, and you referred on to a hospital for any specialist care. In Israel, there's far more access to specialists in the clinic, and the doctors have far more access and more easy access to consults with specialists rather than having to go to the hospital, which has been very helpful.
Brilliant. Miriam, did you want to say anything, or should?
I'll just add one, which is that maybe it goes without saying, but since COVID, there's been also a very big increase in kind of telemedicine, phone call appointments, doing a lot of work over the online portals, which has also been very helpful because it can reduce the amount of appointments that are coming in for medication refills, for example, that you don't really need to see them in the office for that.
Thank you. This we sort of discussed, but Benjamin, do you want to add anything? Benji?
Yeah. So this is very interesting. So I'm trained in Canada, and the scope of my medical training was just much broader. The doctors I've worked with who are trained in Israel, and Rivka might disagree with this, being trained in Israel, but like I worked with a fresh young grad who just decides she doesn't want to see kids, and she has like no pediatrics in her practice. And coming from Canada, office procedures, pediatrics, not so much gynae, but a little bit of gynae adjacent stuff, small basic plastic stuff, ingrown toenails, joint injections. I was a rural doctor in Canada, and I do all of that. And when I came to Israel, they talked a lot about, we talked a lot about how easy access is to specialists here. You don't need a referral to see ortho. You don't need a referral to see all sorts of specialists. I sort of assumed that the fact that I could offer joint injections and ingrown toenail management just would not be acceptable to my patients. They would expect a surgeon to do their toenail and an orthopedic specialist to do their joint injections and stuff like that. And I was shocked to find that it was the exact opposite, at least in the community I work in. People were so thrilled to be like, what do you mean I can just come to you for everything? And at first the Kupa was a little bit hesitant to let me do all that stuff in the office because they're like, well, why do you need to do it? You can just refer out. But when they saw that I was like soaking up patients, really, we recruited almost 200 patients over the last few months from other kupot to join Clalit because they wanted access to the type of service I was providing. The Kupa really changed its tune and was like, oh, okay, sure, yeah, we can get you the equipment to do small office procedures and stuff like that. And so there is flexibility, but you have to really want to do it and stand your ground because I'm not willing to give it up. I love that stuff. And in Israel, I always say, there was this mentality that I learned in the military, which is when you ask for something, the first answer is always no. And then the person you're asking for thinks about the question. So you have to know the first answer is always no, and no never means no. You have to know how to turn that no into a yes.
Benji, I'll ask you a question. Does Clalit actually pay you for those procedures? Because like if you're not a specialist, you're actually getting paid for them.
I'm getting paid my salary, like I'm salaried, so it's the same time. And my patients are coming in 10-minute appointments. So if I'm doing a joint injection, I'm seeing someone in 10 minutes, I don't take 10 minutes. I run late and my patients know that and they respect that because they know they get my time. Someone's not walking in with the need for like a tennis elbow injection and running out to buy the steroid and coming back in. They're booking another appointment for that. So in that sense, I'm paid for it. But it's not just about payment, right? I have my job satisfaction, and I'm not happy if I'm not practicing a broad scope of medicine. I enjoy my job. And if I'm not enjoying it, I'm not working for Clalit.
So
Can I just add that in Maccabi, there's something similar. If you want to do ingrown toenails, joint injections, even stitches, Maccabi encourages and pays for your minor surgery course, and then you offer that as a paid service to your patients or to other patients as a kind of, instead of going to the emergency room for stitches, for example.
I'll say what Maccabi does is they give you certain points. Like you can do an injection, you can get 25 shekels, whatever, added to it. But again, each you have to qualify for any of the procedures you're doing. As I said, I took a dry needling course a couple of years ago, so I do offer dry needling. That's a pain treatment for my patients. There's a POCUS course, which is a bedside ultrasound course, which again, all these things through Maccabi get you a couple extra shekels here and there when you're doing these procedures during your office hours.
Sorry, every time you do POCUS, you get paid extra?
I'm not doing POCUS, but yeah, every time you're doing POCUS, there are a couple extra points added to your patient, yes.
Good to know.
I'll add to that, at least in Maccabi, there's also a course for smoking cessation. So when you talk to patients about smoking cessation and offer them medication for it, you can get points for that.
Okay, thank you. We discussed this. I'm going to skip this just in the interest of time, but we discussed sort of how it looks here and how it compares. Salaries. Does anyone
I apologize. I would like to say one or two things about the transition from being, because there's at least one major difference that took a lot of getting used to and is still taking getting used to, which is the workflow. People in the US will be used to having an MA prepare their patients waiting in the waiting room. It's very orderly, you know what you're getting. In Israel, at least what I found is it's kind of a free-for-all. The waiting room is wide open. The you sit in your office, the patient knocks on the door if they have an appointment. If they don't have an appointment, it's just a very different kind of attitude and approach to medicine there. Um, um, that's the main point I wanted to make.
Oh, thank you.
Sorry, I'd just like to add to that. At my office, I had to have them replace my my doorknob with one that doesn't open from the outside, and this was culture shock from Canada, because to me it was completely unacceptable to be in the room with a patient in their private, confidential time, and for patients to think it was okay to just open my door because I was taking too long or they wanted to make sure there was someone in the room. So that was a big culture adjustment when I moved to Israel, and I had to spend a lot of work training my patients. I still have patients who stand outside the door and like grab the doorknob and try forcefully to open the door because they can't understand why it won't open if I don't open it for them.
That's brilliant. Good thinking. Any other points to add on that topic? I'm just conscious of the time. We'll keep moving. Salaries we discussed. Any other tips about salaries from Sahil and Asmai?
Again, negotiate. As a salaried doctor, that's me. I think is different. It's a fairly standardized pay. But if a salaried doctor, I left myself far too long on a salary which I hadn't really thought about for a while, and it was not what I should have been getting. And no one will come to improve your conditions unless you ask. But if you do ask and you do talk to someone, then you're likely to be able to improve things. And you just have to try and make sure you are assertive to the right people if you are not getting what is a reasonable salary. And that's the case of salaries. It's the case for annual leave. I had it for that as well. I had to make sure that I was getting what would be adequate for someone of my years of experience rather than for my years of service in the Kupa. But if you're assertive enough, then you can usually improve to where things should be.
I'd like to just add that comparing to what I was earning in Canada, there's no comparison. I hate to say it like this, and I don't want to disrespect any Israeli doctors, but had they offered me as a bonus in Canada what I get paid here in a month, I would have considered it sort of almost slave labor had they told me that was like that was my bonus in Canada, what I get paid here in a month. I don't know how it compares to the UK. I don't know how it compares to the States. It is a different planet. And part of, you talk about aggressive negotiation, part of what I did was I used that for my leverage. I said, look, if you guys want me, I was a brand new doctor. They had to find a way to up my salary a little bit. And even then I negotiated into that they have to accept the fact that every few months I'm leaving for a week or two to go work in Canada. Because and again, I don't want to disrespect anything anyone's making in Israel. I was not supporting a family and whatever. I wasn't willing to work for what they were offering here. And I had to make sure that when I negotiated that it included them making sure I was approved for time off to go work abroad periodically.
When you talk about sachirs and how they can negotiate with the kupa, and atzma'i is basically you're fixed on, there's a certain payment per patient per quarter. And the only way to really raise your salary there is to raise the number of patients you're seeing in different ways. So the question is how many hours you want to work and how hard you want to work during those hours. I will say that when I first came here, I started at about a third, 30% of what I was making in the States. But at this point, I think I finally passed where I started then.
I wish I was making a third of what I made in Canada.
Well, can just add two things about being paid out to. So when I worked in Clalit, I was paid per patient, and that's very much what you're saying about you just need to recruit more patients. When I'm currently working out to me in Lebrett, you can get paid that way, but most people, to my knowledge, don't, and you can negotiate on your hourly rates, which works out very, very nicely. Personally, I prefer seeing patients slower and being more detailed and having more time with them, and I think my patients appreciate it too. And it's very nice still being paid per hour rather than having to watch patient numbers or procedure numbers. The other thing I would say with negotiating pay and benefits is it turned out kind of incidentally, it wasn't intentional, but I was working as a employee in two places, and one had far, far higher hourly rate and one had far, far better holidays. And if a benefit of working in two places is that you can play them up against each other. but I got a much better salary from the one that was not doing so well, and the other one gave me far better benefits and more holiday and more sick pay. So it's always worth speaking to people about that, and yeah, it helps.
I could just add something. Rivka? Can I add something, Rivka?
Oh, sorry, yeah, of course, thank you.
Okay, so I just want to add a small thing about salary as a sachir in Israel. Just at least for those in Khalid, it's really important to learn how to read your pay slip, because there are a lot of areas that can be modified in ways that will significantly increase your salary. Those, you were talking about negotiating, but sometimes it's not even negotiating. It's just knowing how to manipulate some of the parts of the salary. And you'll find that there are a lot of areas that can be increased. Like I said, it took me years to learn it. Don't be shy to just go to HR or to a friend and say, please teach me what all these things mean and how can I change them? And you'd be surprised to see how many things you can change and increase your salary with.
Thank you. I think also just to add, like this conversation between Kupot, you learn a lot about what's going on in the different Kupot and what benefits. For example, I've learned that in Maccabi you're being paid per ultrasound, which is something that doesn't happen in Clalit. So that's little things like that can really help you to negotiate and figure out what's going on. I'm happy just to give a ballpark figure as a resident. My monthly salary working 40 hours a week is about 13,000 shekel, give or take. I assume that gets more once I hope, once I become a
yeah, but lots of what to look for, Rivka, though.
I don't know if anyone else wants to share general figures, if that might be helpful, but also no pressure.
I can help out with that a little bit. I just to give I'm a menahel merpa'ah. I've been working as one for 11 years now.
A manager of a clinic.
Right, manager, sorry. Director, manager, however you guys call it. And the brutto salary can reach, upwards of 60,000 a month. So, like I said, there are a lot, before taxes. There are a lot of, like I said, a lot of things that can affect the salary, a lot of small things that you can add. You can add a little bit of work here, add a little work there, all these different haskemim that you can join, how many hours you add on per week in order to get paid more for extra patients that you take. A lot of things that can be manipulated. And, I don't know what it's like in the States. I never worked in the States, but you can reach a decent salary. Certainly for those that work in public medicine, it's one of the highest salaries that there is.
Thank you. Next week we'll be going through what the salary is based on in more detail with the regional directors and the head office doctors. That's next week. Hebrew was a big thing that was asked about. I will just share. I mean, it's like still in debate at the moment. They've required that there has to be a proof of Hebrew proficiency for doctors entering the system just before stage or internship, so between medical school and internship. That's been a recent development, and there's talk about that now being added as well for mumchim, for attending physicians and consultants and qualified specialists. But that's it's just rumors, and nothing's actually been put into place at the moment. Obviously, Hebrew is important. Like, you wouldn't accept in America or England or anywhere a doctor who couldn't speak English. So it's definitely a priority. I know when I first arrived, my Hebrew was so bad that I didn't get accepted to the first kupa that I applied, just because I couldn't get through an interview in Hebrew. So my advice is to start working on that yesterday. Films, podcasts, using AI. I don't know if anyone else wants to add anything.
Yeah, I would like to add to this that as opposed to how foreign doctors are thought of and treated in the US, in Israel, even if your Hebrew is not excellent, patients are very happy and appreciative that you've made Aliyah, and they are happy to help you with your Hebrew and practice their English. And there's I haven't myself found any sense of sort of discrimination or dissatisfaction because my Hebrew is not 100%.
Anyone else?
I will say that, you can get by with smaller amounts of Hebrew in order to make it practical. You could use your hands and use a lot of, point to this and I want to cough and, do different signs. But to actually appreciate the psychological side of the practice, I felt like I had no connection with my patient. I can, yes, very easily deal with any of the technical illnesses, but when you're dealing with the whole psychological side of it, until my Hebrew became really proficient, that was definitely lacking. You weren't building the same relationship, which is important in family medicine.
I'll just add that I work in an area that there's relatively a high number of Anglo patients. And in our area, the patients who aren't Anglo often have pretty decent English. My Hebrew is fluent. I did high school in Hebrew. And some patients, for some reason, switch to English anyways because they think it's going to be easier for me, even though like my Hebrew is really fluent. I swear, I'm not making it up. And English is a very respected language here. And I think Miriam was sort of alluding to the fact that it's not just that people appreciate that you made Aliyah. It's not like you're some doctor from a third world country with like a broken language skill. It's almost observed as like, oh, you're the doctor from America or from England. Like that does get a certain degree of status and respect. And I find patients are very tolerant to it overall. I didn't have to deal with it because I speak Hebrew, but I get that sense from patients for sure.
Anyone else? Well, we can move on. There were questions about whether they could use AI for note writing and translating.
So yeah, I was going to speak on this. So I definitely would never in a million years use AI to try and get information from because it will make up everything. However, where it's really very, very useful, at least for me, because I never did an Orphan, I learned my Hebrew on the job, so my medical Hebrew is fantastic. But if I want to express anything more fluently, it's lacking somewhat. So especially for letters, if you're trying to, so in my morning work, if you're trying to justify specific treatments or specific equipment, it's using ChatGPT or any other equivalent for that. Especially, I personally have it on my phone and logged into the computer as well. So I literally will speak what I want to express in English and ask it to translate it for a male patient in Hebrew. And obviously you have to check it, but it really, really speeds things up. I could write the letter, but it would take me 20 minutes as opposed to dictating it in 20 seconds and have it look more professional. So it's very, very useful for that. Less so for writing notes, I guess you could do. But
I want to add that I'm very grateful that there was an AI when I started working here, because I was forced to write in Hebrew and forced to try and understand the discharge notes and everything. So I feel like if I'd had AI, it would have slowed it down a bit. So yeah, I would be careful about using it too much as a crutch.
Can I just point out that many doctors' notes are in English and it's totally mekubal. Okay.
Acceptable.
Yes, thank you.
yeah, mine it's all in English in the Kupa. In Dia writes in Hebrew, but different setup. Because I couldn't write quickly in English, I'd write in English in the Kupa.
I also write in Hebrew now. I started writing in English, and then we had a check. The clinic was checked by someone within Muchedet who was quite a combative so and so, and thought I should write in Hebrew. So I just said, okay, I'll write in Hebrew, and it was probably a good thing to do to get my Hebrew improved. But you certainly can write in English.
I only write procedure. I write procedure notes sometimes in English because the medical language just comes easier to me. But I've seen many doctors' notes come back, even specialists in the hospital. I've had English notes come back to me.
Thank you. Last couple of questions, just culture shocks. We mentioned about doctors, patients walking in on doctors. For me, the biggest shock was doctors in Crocs. Sandals on the department ward, on the wards, jeans everywhere.
For me, it was that in the UK, you are regarded as the god in white, and then you come here and you're being told by the rabbi of the patient what you should do.
Personally, I was using that from the UK as well. That's where I was working in UK. But it certainly does happen here as well. And the waiting room, as previously, is not your organized kind of thing. It's not the organized thing you will find, certainly in the UK and I imagine in the States and Canada.
I would have to add to that as well. Definitely, I had to change the way I allowed my clinic to run because when I moved into a clinic where it was very, very much that mentality, everyone will barge in, very little respect for appointments, whatever else, and it drove me crazy. I really couldn't work that way, and I kind of went far too far the other way. As in, if I had no appointment, I won't see you just because I now am in a place where uh, some patients really just much left. They left. They didn't want to come back to me. They thought it wasn't nice. But now the patients who come to me, like, come dafka to me because they know that they have my time, they have my focus. I'm not going to be dealing with them and the person knocking on the door and the person shouting at the secretary. Like, that's not how my floor runs, thankfully. So you can force it to be more civilized. The other culture shock I would have is that I would assume that I would have been working in Hebrew the whole time, but I worked in Mezrim, Geula, and now Bar Ilan in Yerushalayim, and I see a lot of kids because people have a lot of kids, and most of the kids don't speak Hebrew at all, or they speak Yiddish. So be prepared for other languages that you may not be as fluent in.
And I already shared my story about having to change the knob on my door. And and I think every Israeli doctor here empathized with that story. But I will say from that I had to educate my patients, and they're learning that that's how I treat them, and they respect it. And so I'm just going to share an anecdote. The other day, and this isn't to this point, the other day, I was like just busy. The secretary and the nurse kept adding patients in who didn't have appointments because the clinic was busy and I was the only doctor there. And this one guy walks up to the door when I happen to open it to let someone in, says, "I just need something quick." And I said, "Excuse me, everyone here is waiting. There's 5 people waiting. I'm a bit swamped right now." And he says, "I'm also swamped." And I just couldn't get over the Israeli chutzpah of like, "Excuse me, you need me, and you're complaining to me that I'm wasting your time because you're in a rush when everyone else is politely waiting in line. You're the one barging in." So that was a very Israeli moment to me. Of course, my secretary ran down the hallway and pulled the guy away because they know how I work. And they sort of have a protective bubble around me. They respect it too.
So that is one of the advantages of being in my own clinic is my secretaries and they do all the clearing out the waiting room and controlling patients' flow a lot more from that standpoint. One thing we haven't discussed at all is the fact that there is officially no on-call status in Israel. But at the same time, patients won't necessarily hesitate to WhatsApp you or call at any time they want. So that's a cultural difference, and everyone can do what they want with that. My patients sort of know that they can send me a WhatsApp if they want. I have no obligation to answer it. If I'm not busy, I might. If I am busy, I won't. If it is emergency, they have different things to call, whether they're calling my cell phone or they're calling one of the mokeds. But that's another thing with the comfort level of sending WhatsApps anytime.
Yeah, that's like setting your boundaries is a big thing here. You have to make sure you set your boundaries where you want them and don't let people push past them because they will, if you give them a chance. So you have to know, you have to know how you work. Your receptionists know how you work. Get the patients to know how you work, and if you're working in a smaller place, get your friends to know how you work. And otherwise, your friends will send WhatsApps at 10 o'clock at night asking for a prescription too. And if you want to keep your friendships, then you set the boundaries in advance.
Brilliant, thank you. We're going to try and end with, I don't know if anyone wants to add finally their favourite thing about working in Israel, and then we can open up for questions and answers, and whoever wants to stay can stay. I'll start. I absolutely love that I feel completely free. Freedom is the word I feel working in Israel. I don't have to hide anything. I don't have to be anyone else. I don't have to explain myself. My patients understand who I am. My colleagues understand who I am. I remember on the first day I walked in with my head covering and my completely Chiloni left-wing atheist supervisor said, "Don't worry, all the food's Mahadran." He sorted me out. It's just completely different to my first day in England where, lots of awkwardness and needing to explain things. So that's been a huge thing for me, which I really, really appreciate.
I would also say I love the atmosphere of working in all the places where I work. In the UK, it was much more like it was a job, but there was no understanding or feeling for your life outside of your job. I had a colleague I remember in the UK, not Jewish guy, not some Israeli guy getting married 2 weeks later. He had been planning his wedding for 3 years, and he wasn't given annual leave for his wedding. And here it's normal when you're doing hospital rotations. Every day of the week, someone's going to be coming in late because there's a bris or some family simcha, and it's normal and it's expected. And your colleagues are interested in your family life. It's not an inconvenience for everybody else. It really is a much nicer place to be working.
I agree with that in terms of you feel very much part of the community you're working in. We unfortunately, and the other side of the practice is the older patient, hopefully the older patients or the patient passed away. Most of the doctors and staff will make Shiva calls. You just feel part of the community. We're not supposed to be seeing soldiers, but if there are patients who've gone off into the army and all of a sudden need something, we'll sneak them in the back door and give them some advice, and they'll say, "Oh, what do we have to pay for this private visit?" And the answer is your service. And so it's part of being the
I'll share that to me. We made Aliyah 5 years ago, and this is home. It was a huge. I mentioned a lot the huge salary cut that I took moving to Israel, and I'll say that isn't. I might sound a bit cynical about it, like talking about really, like it's a chasm. It's like a huge gap. But I'll say there's this old rabbinic tale, and I can't remember who the rabbi was, whose students come and complain to him that one of the students of that rabbi moved to Chul, moved out of Israel and made a fortune. And they're like, when we're here and we're all poor, and the rabbi goes to a valley and commands the valley to fill with gold. And he says, take all you want, but anything you take now comes at your expense in the world to come. And no student touches the money. And I feel like every single day I'm standing at that valley and making the decision not to go back to Canada. And it is a decision I have made wholeheartedly and I have accepted. And I repeat that same decision every day to stay in Israel, because it's not the finances. This is home.
That's so special. Thank you. I think we'll end on that high. This is home. Does anyone have any questions? I'm conscious that we've taken an hour and a half of everyone's time, but it's been incredibly enlightening. Thank you so much to all our panel members and our bonus members as well. Does anyone have any questions? We can open up. You can unmute yourselves.
Rivka, I think we're mostly on the WhatsApp groups and anything like that, but if anybody needs contact information, emails or WhatsApp numbers, feel free to share them.
Thank you.
I'm also happy for my email address to be shared with anyone who wants to reach out.
Likewise, email, WhatsApp, also fine for me.
Thank you.
Hi there. Can you hear me?
Yes, yeah. We can hear you.
I'm very grateful for this being organized. My name is Michael. I live in the UK, salaried GP. I got 5 kids. Where I live, Leeds, is a relatively small city. Jews are leaving Leeds. They're leaving, so they're even leaving to London. And people from London are actually leaving the UK. So I'm at the brink of moving to London, but whilst I see people from London making Aliyah to Israel, my question is, if you don't have that job security and you go, I mean, I understand if you're single or you just recently married, you're still, but if you have the kids, they need to go to school, you got a mortgage here. How can you come to Israel possibly without having a job secured? How would you survive that period in Israel with a family?
I think there are people here more senior than me, but I can't talk about the other kupot, but in your position, I would definitely want to try and arrange some kind of work beforehand. And I can put you in contact with people in Law Meet. I know there's people in Clalis and Mochelet and Maccabi here. I would use this group to try and be in contact, because I agree with you. Like, it's very unstable to come without any financial certainty. So, but I'm sure that any of us would do whatever we can to try and give you a foot in and try and give you connections before you come here.
I mean, I speak 5 languages, everything except Hebrew.
Mm-hmm. So when I went through that process, as I mentioned a few times, I just arranged to keep my job in Canada, which I still have, by the way. And I was traveling back and forth. My situation is unique. They're paying for my flights. They're paying for my car. They're paying for my accommodations. They pay for me to sit on the plane. So it was easy for me. But England is a lot closer than Canada is the other thing. So while I was setting things up, I just kept going back and forth. That might not be ideal, but that was my solution.
I think that's probably actually more difficult from the UK in terms of the setup, in terms of the requirements, in terms of the follow-up you need. You need to be in order to carry on working in the UK. You need to have a certain amount. You need to be working there fairly consistently in order to maintain the administrative requirements for ongoing registration. So it is much more difficult to do that from the UK. That said, I think there are a lot of opportunities for experienced doctors here and for also less experienced doctors, certainly experienced doctors working for a number of years in the UK, plenty of opportunities around the country. Beit Shemesh is looking for doctors, for example. I just know it locally because I'm live in Beit Shemesh. It's expanding, there's new clinics. So even if you haven't set anything up in advance, there are definitely opportunities. I think it makes sense to research, see what's there, make sure you're coming to something, but there are certainly opportunities. There's a need for family doctors around the country, and I don't think there'd be a realistic concern for not having income once you make Aliyah, even if it's not quite what it was. Although coming from the UK, I think it's not the same experience as coming from Canada, from what I'm hearing here. The salary here is, I think at this point, not too different from what I would be earning as a salary doctor in the UK. As far as I know, I haven't been out of touch with UK salaries. From what I see, I don't think it's too different. Living costs have certainly increased as well. That's true. And even with that, we have 1.5 salaries, and we do need that just to be able to get by. But that, I think, is a fairly normal Israeli experience. But I think it can very, very realistically be achieved. And I think it's quite doable with some planning and research.
Sorry, just worth adding, when you make Aliyah, the first 6 months, you get like a stipend from the ministry. So you're paid to make Aliyah. Like you're given 6 months. It's not a lot. You're given a small stipend, which is sort of a nice little top up. And if you work in certain fields, I can't remember, they round up certain salaries within a certain period, and they just passed a new law that you, as a new aleh, something that I don't benefit from, you pay lower taxes for your first 5 years, and they gradually increase. So that helps you out with that. And and any documents that you need translated and certified by a notary, you can actually submit those receipts to the Ministry of Aliyah, and you will get paid back for it. So there's a lot of things that have nothing to do with being a doctor, but stipends and salary top-ups. And like I said, if my observership period, if Pat Cholim Klalit wasn't paying me, then the Ministry of Aliyah actually provided a stipend for that.
Right. Can I think outside of the box? In the UK, there's a lot of GPs, they do like private work. So right now, there's a lot of GPs that do like Botox and fillers, aesthetic medicine, on the private basis. Is that something, I mean, I know this, is there anything in Israel that you know of that, providing that kind of aesthetic medicine on a private basis? Is that possible, you think?
It is possible, but it is possible is the answer. But I think I want to refocus just the question answers just because we're running out of time on the talk that we had now. But there are options like that, and hopefully we'll try and cover a bit more of that in the future.
Thank you very much.
Thank you.
My name is Susan. I'm a doctor in the US, and I want to go back to the question about the Hebrew skills, because I've talked to a couple of Kupot Holim, and both of them have told me straight up that if my Hebrew skills aren't functional, they won't even offer me a job. However, I speak English as my first language. I also speak fluent Russian, and I feel like I could be of service, while I'm taking Ulpan, upon making Aliyah. I'm taking Ulpan now, but I don't think my Hebrew is going to be up to speed by the time I come. And I'm eager to start working. I mean, I understand there's a doctor shortage, especially in my specialty, which is endocrinology. So I just wonder, first of all, will Kupot Holim offer me a job if my Hebrew is not that good yet? And secondly, are there any resources like telephone interpreters that I could use in the meantime with patients, to translate Hebrew, to translate Yiddish, whenever needed? I mean, we have something like that here in the U.S. for Spanish-speaking patients, and it works well. So it occurred to me, whether that can be done in Israel too.
So there are translation services in Israel. Languages of Russian, Amharic, Arabic, I think French, Spanish, Yiddish is not one of them, but for many of the languages. Personally, my Hebrew is not great. I didn't do an Orpan properly. I learnt on the job. My Hebrew is functional. So like in terms of diktuk and in terms of accuracy and grammar, I'm sure it's terrible, but it's functional. I would say you need to have a functional understanding and be able to communicate. Patients are fine with grammar mistakes. They really, really don't care about the fact that I sound foreign because I am foreign. And they appreciate it. So I wouldn't worry about being fluent. What they care much more about is the fact that you're able to communicate, that you're able to understand them, and that you care about them. And that's a much bigger thing. So you definitely do need a level of Hebrew, but in terms of the other languages around, there are translation services definitely.
Okay, but will the Kupot Holy, will the employers employ me?
I think we can ask this question next week.
Yeah.
We'll have the senior doctors. We can ask them exactly where the line is and what they're looking for and what they're willing to accept and what they're not.
That'd be great. Thank you.
Rivka, there's an interesting question here by Israel Nemet regarding academic medicine, training residents, students. Maybe we could talk about that for just a second. Right. So is there a way to also be involved in academic medicine, training residents and students? That's Israel Nemet asking. So absolutely. The main gateway to that is associating with a department of family medicine. And at least in Clalit, every district has its own department. And the department is always looking for madrichim, for, help me out with that, trainers, what are you?
Okay.
Preceptors.
Hey, thank you. Definitely looking for them, and as long as you're qualified, they will, just go over whatever credentials you have, and there is sort of an official course to do that at least my department offers, but if it's very possible that they would accept somebody who has experience doing that elsewhere without having to do the course. And absolutely, it's encouraged, and it's they're always looking for somebody.
Ali?
What was that?
Sorry, someone just raised their hands for the question. Tali? Saga?
Hi, sorry, some technical issues. My name's Tali. I'm a GB registrar, which is the equivalent of a resident in their final year. And I'm just wondering more of a clarification question in terms of eligibility for employment at the point when you're about to finish your specialty training. So if you're considering Aliyah soon after you've completed your specialty training and you haven't actually worked in that specialty as a fully qualified obviously a fully qualified doctor, but not sort of a fully qualified specialist at the point where you're applying, and just to understand sort of what you are, from what I understood, and I joined a little bit later, I hope I haven't missed it, is that sometimes it can take a bit of time between the time that you've made Aliyah and then the time that you are approved to work in your specialty, rather than just approved for your medical license, and therefore you could work as a general physician rather than as a family medicine specialist, like trying to understand what opportunities might exist for employment before that happens, so before your specialty is approved at the point of making Aliyah.
No one's answering. I'll jump in. I recently converted my license. I think it's different because I was coming from Canada. The family medicine training program in Canada is 2 years. I think it's longer in the UK. I had already been practicing for 5 years and I had many hours. They wanted to see some of those hours. So because my residency training program was shorter than the program here, I submitted a letter with recommendations showing how many hours I'd worked post-residency. I know the conversion is easier if you already have a certain amount of years of experience under your belt, as opposed to coming straight out of residency. The UK, I'm guessing, has a 4-year residency like Israel for family medicine. So 3 years. And so I'm not sure, and I don't know if anyone else here knows that, if that lack of that year shorter might work against you. I know, speaking to other doctors who would come from Canada and move to Israel, I was told I should have at least 2 years experience before I make that application, so I wouldn't have to do a longer observership or wait for or repeat a portion of my residency or something like that. But I can't give a detailed answer. I can just speak to my experience.
Any other questions before we wrap up? We're going to have also more opportunities next week to ask questions. So that might be a question for Tali in response to your question. For them, whether they'd be willing to, whether there's room for employing you as a Rofeh Klali before you start working as a specialty doctor as well.
Again, I missed that one. What was that?
Just saying we can ask next week the regional directors whether there's room for being employed as a Rofeh Klali, like a general, like a locum, basically, before your specialty is recognized. And also just okay.
Can I ask a quick follow-up question?
Sure.
I just want to know, do you have to resit any exams if you're expected to make up time by doing extra, I don't know whether it's like some people say like pediatrics or gynae or whatever, do you have to sit exams if you've already passed exams in the country that you qualified in?
I don't think so. From what I've understood, no. You just make up the rest and then they approve you and give you a license. I don't know if anyone else has heard otherwise.
I don't think so. I don't think there's any requirement.
Okay, brilliant. One last question, anyone? We're going to finish at 10:02. No, okay. So thank you very, very much, everyone, for joining us. I just want to put on the screen the QR code if anyone wants to join our community, which is over here. A lot of like what we're trying to achieve is providing, like I said earlier, like the networks, the network to help you to get in and find the jobs and just to make the whole process a lot simpler and a lot easier. I just wanted to put here the MEDEX events that are coming up. There's one in France, New Jersey, London within the next couple of months. These are like essential. You can go there and you can have your license converted. You can start your specialty recognition and it speeds up the whole process significantly. So the questions about what am I going to do whilst I'm waiting for everything to come through, this should make it much, much quicker. And just a shout out for our upcoming event. If anyone is in Israel already, then we would really, really, really love to see you. And our last slide. So thank you very, very much. You can QR, fill in a few details, and you can join our group if you're not already with us. And I'm not sure how to end. Oh, there we go. Tough. So good night, everyone. It's been like we went a bit over time, but that was incredibly, incredibly valuable. And thank you so much to the whole panel for everything that you contributed and shared. And it's so inspiring. We had like over 100 people signing up, who will all be, lots of them will be getting the recording after, and everyone, over 50 doctors here interested in Aliyah and interested in contributing and building, it's very, very inspiring. Thank you very much. And we hope you'll join us all for part 2 for any questions that haven't been answered. And we're open to suggestions. If there's other topics you want to see, other specialties, anything, just message. And yeah, according to demand, we will try and organize things. So that's it. Thank you very much. Shavuot